Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Alpha blockers. Alpha blockers are divided into three types. First two types. They are non-selective alpha blockers and we have selective alpha blockers. Non-selective alpha blockers are again two types. They are non-competitive alpha blockers and competitive alpha blockers. Now non-competitive alpha blockers are mainly phenoxybenzamine. Whereas competitive alpha blockers include we have ergotamine, ergotoxin, then dihydroergotamine, then we have talazolin, phentolamine. Competitive non-selective alpha blockers also includes phentolamine and chlorpromazine are competitive non-selective alpha blockers, whereas selective alpha blockers are again divided into two types. We have alpha 1 blockers are present and alpha 2 blockers. Alpha 2 blocker contains only one drug, that is yohimbine. There is one drug which is yohimbine is alpha 2 blocker, whereas alpha 1 blocker include prazosin, terazosin, dexazocin, tamsulosin, alfuzosin and indoramine, and urapidil is alpha 1 antagonist.
thank you and thank you for watching.